Invitations can change your life. How you respond to an invitation can change the course of your life. Welcome to HEARTtalk with me, Dr. Charles Lee.
We are in Sydney, Australia, and I'm privileged to be able to have this particular discussion with one of the leading psychologists here in Sydney. My guest today is Claudia Rothhaas, and we are privileged to have her with us today. Claudia, welcome to HEARTtalk.
Thank you. I'm very privileged to be able to be here, and I'm very thank you very much for the invitation.
Claudia, I want to come on to this big subject of stress,
Yeah.
because it is a recognized risk factor, stress and heart disease. And you know, in my kind of profession, you're a surgeon, you're operating, and you're type A type of personality, and I get stressed out very easily. But I'm only becoming to acknowledge it now, that it is an important factor for one to consider in one's life, and that is you can't be too stressed out, because so I can't understand what stress is going to do to my heart. You know, I can have stress and you lose all weight and you're not eating, or you're putting on weight because you're stressed out. You tend to binge in more. But tell me from your experience. I mean, has stress been an important factor in some of the diseases that you go through, or some of the uncertainties in life that people go through? I mean, do you find stress is a very important aspect of life that one has to pay attention to?
Oh yeah, absolutely. I mean, if we think about someone who's highly stressed, you would imagine or expect that that person also probably at some stage would start to experience high anxiety. Because, you know, if you get stressed really easily and you sort of too involved in the moment and you get caught up with it and you try to fix things and you try to rush, anxiety is really very close to that.
Right.
But also if you think about getting stressed and frustrated about things and trying to change things and you can't, and banging your head against the wall and not having results with it, you might find that depression is around the corner. Because you start to get hopeless and you're working too hard, you burn out. You know, so I think stress is not just a risk factor for medical conditions, it's also a risk factor to develop other psychological conditions such as anxiety or depression.
Right.
If we think about people trying to alleviate stress, because it's not a very positive thing to experience, they try to alleviate maybe with drinking too much alcohol. They might find because they're so stressed they can't sleep, they might start taking sleeping pills. So we're starting to sort of look at the realm of addictions that might be something that develops out of too much stress. So we can see it's just something that is not useful, not helpful, and doesn't really help to lead a healthy and balanced life.
So as a psychologist, let me put this before you. Here we've got a bag of things that are happening. We've got anxiety, we've got fear, we've got stress, we've got relationships that we need to deal with. It's all suddenly coming in like a railroad, like a train that I took from town hall here, 8 carriages, and they're all on this one-way track. How do we sort this out? I mean, you know, how do we take all this in? How do you help someone approach this train coming in with all these carriages? Because they can all come at the same time, Claudia. I can be stressed out today, and tomorrow I'm anxious, and then I get up in the morning, I'm fear of dying. You know, I'm you know, it's all in a train with so many carriages on a one-way track. And then I wish that at every train stop there's a Claudia there telling, taking out carriage by carriage.
Well, that's exactly right. So what you do is you probably start looking at the train. That's always the first step. Looking at, okay, you know, this is the train, and this is the first carriage, and what do we have there, and then the second carriage, and just really understand what we're dealing with, and then step by step start to think about techniques and strategies how to help oneself with those carriages and that train. And a lot of strategies work for some of the carriages. So if we talk, for example, about relaxation strategies, that will help with anxiety as well with stress.
Right.
as well, with probably relationship issues and other things. So I like to also think of all of those things being connected, and if we start changing little things at one end, it doesn't mean that
The rest are going to
the
get
rest
derailed,
is,
you know.
exactly. So I change something, or I just push a little bit here, and then the whole system starts to change. So
They're all linked, isn't it?
it's all linked. Yeah.
And you mentioned about taking some deep breathing exercises,
Yeah.
relaxation.
Yes.
Look, I have never, ever thought about a relaxation exercise in my lifetime of
You
work.
should definitely try
And
it.
now, I've got this deep breathing that, someone says, concentrate on your breathing, child, get your blood pressure down, because the blood pressure is the ones that have been causing all the havoc.
Yeah,
Is this
that's right.
something that you would do daily? I mean, is this something that you would tell people who even average
Yeah,
people
yeah.
working?
Well, if someone comes in here and they have problems with anxiety, that is one of the first things that I would start to recommend to them, to find relaxation tapes, to start listening to relaxation tapes. Meditation, definitely,
So there is a spiritual component that comes in because, I'm a Christian, and so meditation helps when you're reading the scripture and you just sort of feel so focused
Well,
and you
see, I
trust.
think the spirituality helps with confronting the fact that you're mortal.
Right.
I think even if you're not spiritual and you do something like meditation or yoga,
Okay.
it helps refocusing your mind on something else. Because
Right.
what happens when I'm anxious or stressed is I have a lot of looping going on in my brain.
Okay, tell me about these loops, because I'm interested in the loops now. How
Yeah,
does a
so-
patient now listening
Yeah.
find where do I get onto this loop? Like some of these rats are
Well,
going
for
to a
example,
circle.
anxiety would be a typical what-if loop.
Okay.
Thinking anxious thoughts about the future.
Okay.
What if
Okay,
the
so-
operation goes wrong? What if I don't recover? What if my family suffers? What if they worry? What if, what if,
Right.
what if? And the more I think along those lines, the more anxious I become.
Right.
The more anxious I become, the more I have a tendency to continue with those
Okay.
anxious what if questions.
Okay. So how do you get out of the loop then?
Exactly, and you get out of the loop by stopping those thoughts, which is easy said, but not so easily done. If I tell you stop thinking when you're in that anxious loop, you can't. And
Right.
none of us can really stop thinking. I mean, people try to meditate in caves for 10 years and they can't stop thinking. Our brain is not designed that way. It always continues to spurt out ideas or thoughts. So what we need to do is focus on something else
Right.
instead of continuing with that loop. And that focus could be breathing.
Oh, okay.
Just
Okay.
focus on your breathing.
Right.
And just really feel how you breathe and how,
Right.
your abdomen is moving and how it comes out warmer, goes in colder. And
Simple exercises like that.
plus at the same time as you're breathing, the anxiety reduces. So you're interrupting that cycle on two levels. You stop the thoughts, but you also relax your body, which both helps to calm down.
Interesting,
feel
because
different
there is a sort of a brain chemistry connection, isn't it, that's going on. Because I find that sometimes after bypass surgery, something happens in the brain circuit, and you have the short-term loss of memory, amnesia.
Okay.
I can't remember sometimes certain things,
Yeah.
and so you realize that it's all wired up,
Yeah, it is.
and you need a psychologist to put the wires back on again.
That's And probably the idea is to help you to wire your brain differently so that you manage anxiety, depression, stress, all of those conditions better, understand it better, and then manage it better.
From what you're telling me and telling many of us, how does one now adjust all this to the workplace? Because once you've recovered and you've come out of surgery, it's back to the workplace. And I found it very difficult in the sense that relational-wise, when we talked about relationships, I mean, they were for friends and colleagues, because they were it's hard to think of a doctor getting sick,
Yes.
That's the first thing that hits you. Charles, of all people, that kind of thing, and so that's one issue to deal with. It's your colleagues. I just saw you walking yesterday, another girl was telling somebody else, and then that person ended up with heart surgery, things like that.
Yeah.
So let's just come and talk about adjustment. How does one now, having dealt with all those carriages, take that train and lock it into a station now and be able to unload and come off and relate and adjust first to the environment of work? How do we do that?
So again, I think the key is self-awareness. So to really be mindful of where I am on that journey in as recovery. So if I'm still weak, or if the operation is still very recent, I probably need to think about some flexibility around maybe being allowed to come in later or go home earlier. So probably make sensible decisions around how much am I going to go back, or can I maybe start with lighter duties, or so really again acknowledging that something big has happened, and I need to probably give myself a little bit of time to get back slowly. At the same time, I would probably recommend to not stay at home for too long, because I think going back to normal is also helpful to distract. You know how we talked about unhelpful looping, mind thought patterns that create anxiety and stress and depression. So sitting at home and having too much time might make it a lot easier to have more what-if questions, or to dwell more on what happened in the past. So I think work is probably a good distraction, but it probably needs to be really balanced with my medical condition and my state, and just not overdo it. So I wouldn't advise to just go back full on after 2 days of surgery, but probably also I wouldn't recommend to stay at home for too long.
Okay. Do we want to do just the last question up in the park, or will that be too much of a... You're game for that?
Yeah, happy to go.
Because I thought we would talk about lifestyle.
Yeah.
Something lighter there, less on a consultation kind of thing.
Yeah.
Shall we do that?
She's electric.
Now, are we okay? Young man? So I'm going to talk to Claudia this way. So are we close enough?
Yep.
I'll be happy to get closer.
Yeah, okay.
All right. Is that light on?
Yeah. You want to bit closer this one?
No. Light on.
Light on.
The screen okay.
Screen okay.
Both of us are in.
Yep.
Okay. Recording.
Yeah.
Huh?
Yep.
Okay. Claudia, what a beautiful scenery here, right here in the Botanical Gardens. I mean, in fact, we should have our psychology clinics here. Put everybody on this is the last carriage of the train. And I want to now talk to you about lifestyle. Okay, because certainly I had to change my lifestyle. It's no more, I mean, I was obese, 100 kgs of food, I would eat anything. I mean, the activity was there, but not as much as I would have liked to. But I think lifestyle change is critical.
Yes.
In fact, I start the day with the word AM, morning. Activity, moderation.
Very good.
And I close the day with PM, prayer, meditation. So tell me about lifestyle change. I mean, how important it is for us as bypass patients, or for that matter, anybody who has gone through such a trying, event in life. I mean, lifestyle change.
Yeah. Well, I think that really, if we think about it, everyone should live according to what we say a healthy lifestyle is. But we just believe that we get away with not doing it. We believe we get away with eating too much fatty food, with smoking, drinking too much, not exercising. We don't. And it's now about I think after a traumatic event like that, it just really brings it home to us that we need to now actually listen to what, the doctors and the experts and the health people have been telling us for a long time, which means all the things that they keep saying, enough fluids, not so much alcohol, no smoking, healthy food, exercise, and not so much stress in our lives. And keep a balanced lifestyle where we have work, but also life, which is, task orientation, but also pleasurable activities. We need to find a way to keep all of that balanced and healthy. That's what it is about.
Because that's a very key issue. For example, just lifestyle change of diet,
Yes.
for that matter.
Yeah.
I go up to the kitchen and I tell my wife, cut down the oil and cut down this and cut down that, and then you got a family. And so it's quite stressful for the wives in themselves or any other spouse to be able to also change a bit of their lifestyle too, because you become a member of the family. And sometimes I can't help but feeling a kind of a burden, because here they are all excited to have a good meal, and I've come in there and I think another added kind of challenge to change it, because the whole family can't change.
But I guess in that case I would really like to encourage you to think about it differently, because really what they're doing is they might be looking forward to a good meal, but is it really good? Because it's not healthy. Really what you're doing is you're adding the health aspect into your family, and they should have done that anyway,
Right.
So you're probably helping to get your whole family a little bit healthier, and maybe hopefully they might even have less health problems and a longer life because of you. So it's really about changing the way of thinking about it.
This is tough. I mean, to talk about getting away KFC from the table and McDonald's from the table, and oh God, Dad, what have you done? But
that should have happened anyway. They should not.
I mean,
do that.
I think I agree with you. I think it's all about health changes, isn't it? And being able to live that lifestyle that keeps your new vessels open.
That's right.
And it's all about life, isn't it? The holistic aspect of life.
That's exactly right. Yeah.
And so what about those who have gone through, say, for smoking, for example, alcohol, and, I mean, how important is that in your practice, where you have to help people out of it? How do you do that?
Yeah, I mean, from my experience, I've been working with drug and alcohol services here in Australia for quite some years, way back, and it's very important. If you want to be healthy, there's a combination, there's a link between a healthy body and a healthy mind, and you can't really lead a healthy lifestyle if you're drinking way too much alcohol and if you're smoking cigarettes, and it's all affecting your body as well as your mental state. So it's crucial to look at those things, and really something like the heart surgery is a wake-up call, but really we should have done it anyway.
Yeah, true. I mean, I agree with you. It's a wake-up call, and then one has to put all these carriages together and make sure it's running on a new track.
That's right.
And so finally, the last carriage,
Okay.
when we have had this wonderful discussion with you, and I really feel, and this is coming from me personally, that the last carriage should actually be the first carriage, and that is to be able to talk to a psychologist before one goes through such a process like bypass surgery, because a lot of what I've talked to you now has been personal, and I'm sure that many out there who are listening to HEARTtalk will be going through the same carriages,
Yeah.
And so tell me from your own personal perspective, wouldn't you think that prior to surgery, heart surgery, bypass surgery, where your heart is literally stopped and having to start again, and I tell you something, on the night before surgery, Claudia, my most difficult moment was when I sat down and wrote letters to my family, my 3 children and my wife, Monica, Jeremy, David, Sarah. I sat there and I wrote a letter to each one of them, telling them what I would expect them to do should I have and not make it. Because I know that about 5% can have problems after surgery. They thought that, Dad's going for heart surgery is like appendicectomy, just go in there, take out the appendix, but they have no idea about the magnitude that can be serious problems. So now that I'm going through all the emotions with all the experts and putting them on HEARTtalk, don't you think that a consultation just to talk with a psychologist prior to surgery, which should be part and parcel of the whole rehabilitation recovery program
Yeah.
of every heart patient.
Yeah,
What
I
do you think?
absolutely agree, because I think it's very important to educate people around the process and around the symptoms and steps along the way that they probably will encounter. And it's obviously not about scaring people or making them more fearful, but educating them so that they are prepared and giving them strategies so that they know what they can do, or maybe, you know, if there aren't strategies, then at least giving them contact numbers or follow-up appointments so that if they don't know what to do, they have people to go to and you know, so that they can find the information and the advice that they need. So, I mean, just 1 hour of probably outlining the different stages that they will probably encounter with them will probably help them to prepare.
Yeah, I mean, that's really sweet advice, and coming from a wonderful person like you, on behalf of HEARTtalk and on behalf of Azim, who has helped me here today, I want to just say thank you, Claudia, for doing
Thank you
HEARTtalk
very
with
much.
us.
It's been a pleasure.
Thank
Thank
you.
you.
Yeah, and I want you to say, you know what I'm saying, and I need more, 'cause I'll be you and you be me. There's lots and lots for us to see. There's lots and lots for us to do. She's electric.